Welcome to our Commissioner Status Update. It's March 19th, 2024. The time is 10 a.m. I'm calling this meeting to order. In attendance are Commissioners Brooks, Matari, and Duncan. Are there changes to the agenda?
Yes, I'd like to remove item number 4.
Okay. And public comment. Okay, hearing none. Item 1, Justice Center update. This would be from Turner, Townsend, Heery, but Mr. Mendez is out of town, so our Boughton's John Staub is here.
Hi, John Staub with Boughton Construction for the record. Just providing an overall update, starting with financials. You have before you contingency use authorization number 103, which is for value additions log number 1, and that's the 8 items that were previously discussed. I believe is on the agenda for today at 2 o'clock for
Yes.
review and final approval. The next item up is CUA 104, which is for the stainless handrail item from the value additions log. If there's any further questions, I could take those now on that.
Okay.
Or any
So,
discussion.
yeah, it is up for approval at 2 o'clock, but did you want to have any discussion on the handrail?
You mean the
Stainless steel versus the metal?
it's on the 2 o'clock. Yeah, it's fine. I mean,
Okay.
look, in the end, I think that with an open stairwell, it's going to get a lot of use. And if you look closely at the stairwell here, you can see the paint brush marks on it. It just doesn't have a very nice look and feel to it. And I think that for the courthouse, we probably should have something that will hold up a little better.
Yep, I agree with that. Bill, your thoughts on that railing?
Not for the kind of money it's going to cost.
Okay. All right, well, looks like two of us are leaning that way, but we'll make the final decision today at 2.
Okay, great. The other items that are in the works, CCD number 5 that David has been updating you on, we have submitted final pricing for that to the architect and David for their review and approval on that before it goes to you. The current amount is a design contingency draw of $9,782, and that's just for a handful of miscellaneous structural updates and things of that nature. Inherent to the design development. So that I'm sure will go before you as soon as it's been through its review by the team. We're currently working on collecting pricing for proposal request number 1, which is for the 3rd floor office reconfiguration that's been requested by staff, I believe. It's very, very minor modifications amounting to what appears to be less than $5,000, but we're working on final pricing on that we'll submit to the team for review. Another one that's been submitted to the team for review already were some comments made by the structural engineer through the shop drawing review process for rebar that clarified a design document discrepancy from our perspective, and so we've submitted a design contingency request for $20,439. And those are the main pending cost items. Any questions?
Questions?
Okay. In terms of schedule, concrete work is progressing very well. We're starting to really get a rhythm out there as we figured out this formwork system. We are utilizing overtime to maintain and optimize the schedule, and really trying to take advantage of good weather, which we're thankful for over the last week. We've got some more cold weather on the horizon next week that will slow us down a little bit, but that's part of the plan. CMU started last week and is progressing right on schedule, if not a little bit ahead, so we like to see that. The architect has been out to review the quality of that first installation, and we are full speed ahead. Steel is on track to start erection on May 6th, so that's another really big milestone, a little over a month out. And our team is working on assembling an updated master schedule, our monthly update, which we'll have published for the team by the end of the week, along with a memo on any of the changes that have been made. So that is everything on cost and schedule. Any questions?
Okay. Questions?
No, thank you.
All right.
Great. Thank you very much.
You're welcome.
Okay, item 2, the child vaccine resolution, and it was in your, the daily, sorry, it's not called the daily, it's the weekly folder. What I just really wanted to do, like I said last week, a constituent had brought this forward. I actually ran it by Dr. Duke Johnson, our coroner, and he's also in the Panhandle Health District. So I would just like to know if the board would like to bring this forward, and if so, if there were any changes that you wanted to see, and then we could bring it forward to a business meeting for approval.
I'm not opposed to it, but I don't think it's anything that the county commission needs to be concerned about.
Okay?
What is your intent or goal with this?
So my intent is to bring it to Panhandle Health's attention, since they are one of the organizations in our community that I think should be aware of this information, kind of in this format. There's been other counties in Idaho who've passed this, and ones across the nation. So.
Look, I applaud the idea that, when it comes to these mRNA vaccinations, I never took one. No one in my family took one. I have serious reservations about any kind of medical procedure that doesn't go through all the normal, proper testing procedures, which this seemed to bypass that. But have you read any of the appendix links in here, Commissioner Duncan?
I have read some of them. I have not read all of them.
Okay,
And-
because I've done a lot of research on this, and what I've discovered is that you've got published peer-reviewed, which is the highest level, and then you have published professional articles, which are not peer-reviewed, and then you have websites, and you look at those websites and you say, is there contact information or is there no contact information, right? And so I looked at some of these sources. The very first one, openveers.com. There's no domain registration information. There's no phone number. There's no address. There's nothing about the people behind it.
Okay.
I mean, nothing. So I go further down. There's another one here for this COVID vaccination and age stratified all-cause mortality, which, I think anecdotally we can all look at things and kind of connect the dots, but I can't tell if that's peer-reviewed. There's this one here, item 7, the page not found. Item 9, here's the second half of the abstract. These data may impact the surveillance of vaccine mRNA in breast milk or plasma. RT-qPCR assays targeting the vaccine mRNA cannot discern DNA from RNA without RNA-seq or DNA-seq nucleus treatments. Likewise, studies evaluating the reverse transcriptase activity of line 1 and vaccine mRNA will need to account for the high levels of DNA contamination in the vaccines. The exact ratio of linear fragmentation DNA versus intact circular plasmid DNA is still being investigated. So they're still looking at it. Quantitative PCR assays used to track the DNA contamination are described. It doesn't even give you a conclusion. So how does that link to your document?
Well, that's a good question. And on Commissioner Brooks' side, he says not for the commissioners. And if you are against bringing this forward, then that's totally fine. I just said I'd bring it forward because a constituent asked me to.
Well,
And so if that's not
Yeah.
acceptable, then I'm fine with
Well,
it.
I'm all for it. It's just that I want to make sure if I put my signature on something that it comes from very credible sources that we can back up and we can explain, because I usually get asked, why did I sign for something? And I want to be able to articulate it.
So if there are,
There's another one here, number 10. It's an abstract using a single person as the study subject.
if you would like to go through those and say which ones that you would like to take out then I'm happy to hear that.
Well, I think that since it's your project, I would argue that you go through it, and I'm more than happy to look at it afterwards. And, I'm very supportive of, this technology going through the proper testing procedures and the proper analysis before it gets released to the public. And I'm very against people being compelled to take any kind of medical procedure that has not been properly tested. But I think it's important that if we're going to present things as a board and sign them, that we know exactly, where these sources are. One of them actually references Infowars.com. And I just want to make sure that if my name is on it, that I can stand behind the sources and that I feel comfortable.
So what if I pick sources that you can't stand behind? Are you going to go back and then?
Well, if you pick the sources that I can't stand behind, then it's hard for me to support this document.
So I guess what I'm saying is I don't know what you can and can't stand behind. So if you wanted
Well,
to.
like I said, at the top are published peer review documents and studies. Next are published professional articles that are not peer reviewed. Next are websites that have contact information. And next are websites that don't have contact information. So when I looked at, this very first item, openveers.com, I said, okay, how do I contact these people? And the only thing I could find was info at. No phone number, no address, no people behind it. And that's usually a tell for me that you should be careful about the data that's being published, because you can't tell if the people are credible, if the people, can source it from other places. I don't know if do you agree that websites like that would be credible resources?
That's what this discussion is for. It's not that I'm saying this is ready to go. This was a discussion if the board would even be willing to look at this further.
Okay, well, so I guess things like this need to be kind of asked or answered. And I'm happy, like I said, I totally support this. But it's got to have supporting documentation that can't be criticized easily by professionals. And if we're going to ask that Panhandle Health look at this, I think Panhandle Health would probably want to know how to contact the people at openveers.com if they had a question about it as a resource.
Okay, thank you. Okay, item 3, Transit Department Program of Projects 2025 through 2029, and Chad Engel.
Thank you, Commissioners. Chad Engel with the Transit Department for the record. I just wanted to bring before you, since we're going to be talking about our program projects in the business meeting later, just a little bit of information about it. So the program projects is a list of proposed projects by recipients, so those receiving FTA funds, for a given fiscal year to be funded from the Urbanized 5307 annual apportionment. So the POP includes a brief description of the projects. It goes into the total project cost. Then it has the federal share and the local share of those projects. So the POP is updated on an annual basis as required by FTA. So we bring it before the board on an annual basis. So as a public transportation agency, the first thing that we do is we identify those projects that we're wanting to put on the list of our program of projects. So from there, these projects are things such as our capital, our operating, our planning. And so in compliance with the requirements and guidelines from FTA, we then publish in the paper anything that we have for our program of projects, and then we conduct the public involvement activities as proposed in the POP, the program of projects. So this includes the publication for the opportunity for a public hearing, which that's another item that's going to be on the business meeting later today as well, just the approval for that public hearing. So after we've finalized the POP, then it goes into the Metropolitan Planning Organization project, which is known as the Transportation Improvement Program, which we refer to as the TIP. So after it goes into the TIP, that feeds into the STIP, which is the State Transportation Improvement Program. So once it has fed into the TIP and the STIP, then we're able to draw it down from our FTA apportionment. So that's a quite the process, but that's how we're able to then draw down our funds from FTA. Did you have a question, Commissioner Douglas?
No, it sounds like a Dr. Zeus story.
Yes, but that's the process
I
that we have
understand.
to go through for this.
You didn't make it up.
No, it's not. So annually, we have to certify that we can abide by what we put in the POP. So we have to say that we are legal and financially technical capacity in order to carry out our proposed POP. So we do that on an annual basis as well. And this includes our safety and security aspects of the program as well. So we're required to provide a financial plan that delineates the source of our non-federal share, which is our local share, and the amounts that apply to the different sources within our POP. So the time frame for it also goes into the time frame for the acquisition of those local share funds, and then the recipient has to have a multi-year financial plan, and it goes over our operating and capital revenues and expenses involved in implementing these FTA awards. So we have been working with the auditor to ensure that our program of projects is in line with county goals and objectives. So you have in your packet our program of projects. So if there's any questions, we're happy to take those.
Okay. Bill, any questions on this? Bruce?
No questions, just the only comment as we work through this. My hope is that FTA can provide an asset list as well as staffing counts and even an org chart possibly for today and how it sees itself in the future.
Okay.
And not just dollar amounts. Just because prices are going up so fast, it's the dollar amounts kind of, obfuscates, well, how many buses do you need? How many people do you need? And things like that. So
Yeah, so part of our discussion with FTA has been kind of in line with that. But it is FTA's prerogative, and the way that they position is they're not going to tell us exactly how many people or what the structure looks like, but it's up to us to figure out what that technical capacity is in order to fulfill all of these obligations.
yeah, and that's where I was, the question is really geared more, or comment is geared towards yourself and not FTA, because you're managing it, so. But thank you so much.
And that is something that we are currently working on.
Yeah, perfect, thank you.
Yep.
Okay, any other questions? Okay, item 5, Lakeland SRO contract for FY25.
Good morning, Commissioners. Under Sheriff Brett Nelson for the record. As we prepare to prepare our budgets for fiscal year 2025, this Lakeland School District reached out to us seeking clarification as to what funding we would be seeking as a county for their school resource officers. If you recall, last year, late into the budget, we accepted and took over the school resource position at Timberlake High School, and we honored the 65% funding of that. That going forward, I wasn't sure if we wanted to stay with the 65% or move to the 70% that we originally discussed, I believe 18 months ago, if not 2 years ago.
Right. Yes, Bruce?
I think that we should try to incrementally get the other jurisdictions to at least cover the cost of the services that the counties provide. And so if we're going from 65% to 70%, I'm completely in favor of that.
Bill?
That's a small bump, and they've known about it for a long time. So I'm in favor of the 70%.
Yeah. I've just been concerned that we weren't consistent across the county with all the school districts, and I think this brings us up to all school districts, I think, are being charged the same now.
I believe you're correct
7%.
by doing so.
Yep.
So we'll move forward in doing such.
Yes.
Thank you.
Thank you. All right. Item 6, insurance non-disclosure agreement discussion. Bruce?
Yeah, this was something that came about. Commissioner Brooks and myself thought it might be, and I apologize, Commissioner Duncan, I don't remember if you were okay with it or not, getting a quote from a private carrier, Redmond Insurance, for the county compared to what ICRIMP charges us. And I just want to make it clear that I have not sought this. Redmond Insurance actually contacted me. I know that there are many different factors in a municipal type policy compared to a private sector type policy, but this is something that they felt that they could do. And it seems appropriate, maybe once every 5 years, to at least look at it and understand what those differences are. So as Redmond has tried to obtain information, candidly, I'm a little surprised at the resistance to some degree of just trying to obtain the information so they can give us a quote. And as a consequence, apparently there's a fair amount of information that is non-public that ICRIMP would be willing to share information with Redmond if we had a non-disclosure or a confidentiality agreement. So I don't have a problem with that if that's what it's going to take for them to at least get the information. I wouldn't be surprised because the devil, as always, is in the details, and it's not what is covered but what the exclusions are. But we're kind of at an impasse here because we can't at least figure out if it's even worthwhile because Redmond can't get the information.
I have some thoughts on this. Go into executive session for a few minutes.
Well, that's not on the.
It's okay. We can
Yeah.
go into this. It's not the only item on the agenda.
Okay.
Yep.
But I have some advice about this issue.
Okay.
Okay,
Would that be okay?
Yep.
In about 5
Yeah.
minutes.
yep. All right, so I take a motion to move into executive session under 1D.
Okay. I move that we enter into executive session 1D.
I second the motion.
Bill Brooks,
Aye.
Commissioner Matari,
Aye.
Chair Duncan.
Aye. there a motion?
I move that we exit executive session 1D with staff to proceed as discussed.
I second the motion.
Bill Brooks,
Aye.
Commissioner Matari,
Aye.
Chair Duncan.
Aye. Okay. Any further discussion on the insurance non-disclosure agreement? We're not quite ready to execute one of those yet.
No, I'm fine with that, so.
Okay. Okay, public comment. Come on up.
Ron Hartman for the record. I thought I heard in the Justice Center update, as I heard it, that they want $20,000 for what appears to me to be their design error. And if I've got that correct, that should be absorbed by them and not the taxpayer. They should fix it and they should pay for it. Thank you.
Thank you. Okay, anyone on the line, Jonathan?
We did get one comment from Harry Craviotto. He commented, "We need competition in the insurance. This cannot be a sole source to one CO."
Okay, thank you. No other comments? 10:33 meeting adjourned.